بسم الله الرحمن الرحيم. Thank you, dear colleagues, for kind invitation. Thank you for Dr. Mahmoud for nice invitations. Thank you for committee for this valuable mini symposium. Thank you for my wife for this presentation. Thank you for the best teacher in our life. Thank you for our Saudi patient. Indeed, today I am not so professional. The topics was covered by our senior professors in very perfect manner. So today I will be only postman to carry a message about the woman. Indeed, the woman cannot add days to life, but of course add lives to day, and her rights to seeking the best evidence, medical advice to let her life better and better. Today I will speak about short message, how to prevent thromboembolism in pregnant women. Don't concentrate with the slides. The lecture available in the guideline in the internet. Only try to take the message. If you take the message, apply this, it is the best success to our symposium here. So I will start from the end. What is the conclusion in this topic or this message? The conclusion that every pregnant woman tell us, please assess my risk factor for venous thromboembolism. This is the role of the doctors, of the nurse, of the paramedicals. This is the role of you as a human being towards your wife, towards your mother, towards your daughter, towards your neighbor. It doesn't mean that you must be a physician. You must be a human being to assess the risk of thromboembolism and give advice to every woman. Unfortunately, the most mortality rates occurred in MCH hospital from pulmonary embolism. Unfortunately, till this moment, no agreed protocol applied. So please consider this a message, and you are morally responsible for conducting this message to everyone. Why pulmonary embolism is important? For example, in United States of America, the death from pulmonary embolism greater than the death from AIDS car accident together in 1 year. If I shift from America to England, the mortality in England every year is calculated. We will find important thing. This is called maternal inquiry about confidential inquiry about maternal death. Maternal death due to pulmonary embolism is the third one, very important cause. I need to observe something. During 3 years from 2006 to 2008, this is the number of deaths occurring in the United Kingdom. Comparing to this number in 10 years earlier, there is market reduction. Why market reduction? Because they study the problem, put a protocol, follow the protocol, audit the protocol, so they can resolve the problem in scientific manner. And this is a very important lesson, how we can address our problem how can put management, how can follow up this management, how can evaluate our management, how can modify our management, and this is the first message of this slide. I will shift rapidly to risk of pregnancy. Pregnancy carry a high risk for thromboembolism in general. Did you imagine that the risk of thromboembolism with pregnancy greater than the contraceptive pills? All of us are afraid from contraceptive pills. Why? It was thromboembolism, but no one pay attention to the pregnancy. Pregnancy is very important risk factor for thromboembolism. Why? Because in pregnancy there is the three elements of workout triads, as mentioned by our senior professors before: the abnormality in blood flow, and the blood component, and the vascular injury. All together are present in the pregnancy, as demonstrated by this stasis of the blood vessels occurring by various causes, increase in coagulating factors, in addition to the endothelial injury, and all of this carry the risk of embolism during the pregnancy, and of course for examination it is more common in the right leg than the left leg. When these three elements are available, what is the result? The result is unfortunately met together. The formation of thrombus may be the venous thrombosis. When it is formed, may shift to the lung and causing fatal pulmonary embolism. Of course, if this occurred, this is bad news. But our message today carry a good news. What is the good news? Many pulmonary embolisms are preventable with appropriate thromboprophylaxis. We can prevent major of this from thromboembolism. NICE, National Institute of Clinical Excellence in England, estimated that low molecular weight reduced venous thromboembolism risk in medical patient and surgical patient by 60 and 70% respectively. Doesn't eliminate the risk completely, but decrease the risk to great extent. And it is reasonable, therefore, to assume that it may reduce the risk of venous thromboembolism in obstetrical patient by up to 2/3. So, by assessment of the risk factor, by putting appropriate thromboprophylaxis, we can save many lives in our area. What is the recommendation? Rapid recommendation. This is the recommendation mentioned by Royal College of Obstetrician and Gynecology guideline. During pregnancy, remember that this is your role. If you meet any non-pregnant in BHC, a non-obstetrical unit patient, or any female, assess her risk factor for thromboembolism. Find her it is high risk for thromboembolism before pregnancy. Please advise her about the importance of investigation and the importance of thromboprophylaxis in the future. And this is your message as a doctor and as a nurse. Evaluate before pregnancy, and if you face a patient with early pregnancy with risk factor, direct her towards thromboprophylaxis or let her to ask medical advice. This is the first message. What is the risk factor? Unfortunately, we are living in the era of risk factor, particularly in this area. Sickle cell disease, hot weather, immobilization, grande multivara, age more 35, parity more than 3, immobilization, admission to the hospital, hyperemesis gravidarum, ovarian hyperstimulation syndrome, admission to the hospital, cesarean section, infections, wound infection, blood transfusions. If you imagine anything, it is available in our area as a risk factor. So please respect the risk factors for thromboembolism in pregnancy. particularly pregnancy birth is very important risk factor for thromboembolism. I need to mention, if you face any woman or encountered any woman with a history of thromboembolism in the past, either pregnant or non-pregnant, and this thromboembolism was unprovoked or provoked with minor element. She mentioned that I have thromboembolism, but I have very important risk factor. Not I was not pregnant, not taking contraceptive, there is no fracture and so. Please remember to ask thrombophilia screening, either acquired or inherited. Thrombophilia screening is important. Why? Because it will change the plan of management during pregnancy and after pregnancy. Remember thrombophilia screening. The second message, when to start thromboprophylaxis when indicated in pregnant patient. Do you start early or late? Please, 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 don't be late. Start your thromboprophylaxis as early as possible from the first trimester. Don't wait for second or third trimester. Why? Because great number of maternal deaths in United Kingdom, not in high area of risk like here, occurred in the first trimester, after miscarriage, after abortion, after hyperemesis gravidarum, and this can be prevented. Start your thromboprophylaxis as early as possible. Don't hesitate to write thromboprophylaxis. No need to send her for MCH hospital, for example, after 1 month or 3 months. You can start your management and counsel later on. The second message, what about the best pharmacological thromboprophylaxis? It is mentioned in the guidelines that low molecular weight heparin are the agent of choice for antenatal thromboprophylaxis. These are at least as effective and safer than unfractionated heparin. Same efficacy and more safer, and this is the recommendation of the guideline. As we mentioned, and our colleague mentioned that in thromboprophylaxis can work through activated factor 10 and activated factor 2. The thromboprophylaxis who act against activated factor 10 has antithrombotic action, while the factor working against activated factor 2 has anticoagulant action. The factor who carry greater antithrombotic action is better than the factor who carry probabilities of antithrombotic action. Low molecular weight heparin working here, unfractionated heparin working here and here. This can explain, this is the difference between unfractionated heparin and low molecular weight heparin. Here, this is the unfractionated molecular weight heparin. It combined with antithrombotic forming a complex that come to activated factor 10 and causing deactivation. This is antithrombotic action. Excellent. This complex, when try to deactivate activated factor 2, it is low molecular weight. No space for him here, so its action is not complete. So the anticoagulant action is weak, and this is advantage. I need to compare these pictures to this picture. This is the traditional or conventional heparin. Antithrombic combined with unfractionated heparin, it causes complete deactivation of activated factor 10, antithrombotic action very good, but it inhibits activated factor 2 and has what is called anticoagulant and the risk of bleeding. So it is low molecular weight heparin is more safer than fractionated heparin with low side effect. Again, our action here and here. This is the equation. Why low molecular weight heparin is happy? Because I had antithrombotic action greater than anticoagulant action. Why the heparin is sad? Because it has anticoagulant action greater than antithrombotic action, so the risk of bleeding occurs. So it is safer, low molecular weight is safer. This is the message during this slide. I need to mention that during pregnancy, You remember the risk factor I mentioned? Yes. If any woman with 3 risk factor you met in your life, your daughter, your sister, your, and evaluate the 3 risk factor, start here thromboprophylaxis. Remember again the risk factor. If you have a look, we are in the era of risk factor in Al-Hasa. Signal, hot weather, immobilization, parity, ABC, 100 risk factor in our life. Don't hesitate, please. Venous thromboembolism. Woman has only single venous thromboembolism, not related to pregnancy, not related to estrogen, and provoked. Provoked means caused by strong action, like for example, orthopedic surgery. You can put the patient under close surveillance during antenatal, but must be given postnatal. Okay, postnatal, all must be given. But if the patient with single and not recurrent, not estrogen related, if estrogen related or related to the pregnancy or another additional risk factors or unprovoked or other thrombophilia in the family, first degree family, you must give thromboprophylaxis molecular weight during pregnancy and after pregnancy. So evaluate the risk factor in any pregnant woman carefully, please. Women with thrombophilia, as we mentioned, if this woman has asymptomatic thrombophilia and this thrombophilia was multiple or another risk factors or more than one thrombophilic screen, please prescribe thromboprophylaxis for her during the pregnancy and after pregnancy. Now, you give the woman thromboprophylaxis, she is at home, and call you, my doctor, I am suffering from labor pain. What is your advice? Your advice, please stop your low molecular weight heparin, go to the hospital where we can evaluate if she needs further dose or waiting till delivery. Why we wait? Sometimes we need giving epidural anesthesia or spinal anesthesia, and there is the risk of hematoma during this. This is regarding thromboprophylaxis. So your advice, stop with labor pain or bleeding and go to your doctor. Don't stop and stay at home. Stop and go to your doctor, he can evaluate. There is no fear of risk of bleeding because this is thromboprophylaxis. Our fear here about the hematoma with, as we mentioned here, with local anesthesia. Now, the patient go to MCH, delivery room, where the recommendation for delivery. What is the recommendation during the delivery? As a human being, not a doctor, no time to think. You can recommend the general message to the patient. The most serious part in our life during these few minutes. After admission in our hospital, MCH or obstetrical unit, please doctor, please sister, please midwife, assess again the risk factor. Assess, 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 assess. Very important thing. If you face a young woman, 21 years, primary, died from pulmonary embolism, this is a disaster. You are responsible morally about this. Please assess the woman in delivery room. The second, remember this slide. Remember the sound of water. Remember the sound of water and mobilization. Hydration of the patient very important, unless contraindicated. Mobilization of the patient during labor is very important because in our closed area, we put the patient on continuous CTG, not mobilized, no fluid, and this is very dangerous. And also hydration, mobilization during labor. This is the advice to your sister, to your daughter, to you during labor. We are speaking now as a human being, not doctors. In delivery room, please remember AED, not against discharge, against medical advice. AED, it is a stand of Ashraf, عطيه, دويدار, the speaker. I intended to put this. Why? To remember this equation. You will remember this equation after 100 years. What is the equation? 2 plus 3 equal to 5? No. Equal to 7. In delivery room, if you find any pregnant woman in delivery room with 2 risk factors, prescribe thromboprophylaxis days in the form of local heparin if indicated. If you find the 3 risk factors, write thromboprophylaxis 7 days in pharmacological manner plus good elastic stocking. Remember, 2 plus 3 equals 7. This is AED. Remember to apply in your life. This message is sent to our delivery room. This is the recommended AED equation. Please remember evaluation of the patient body mass index. Obesity is very important risk factor. Morbid obese woman after normal vaginal delivery or cesarean section at least 7 days thromboprophylaxis in pharmacological manner. Thromboprophylaxis in obese pregnant woman. The body mass, all of us know this, and what is the difference between morbid obesity, obese, and so on, and this is available in the lecture. Regarding cesarean section, there is 2 types of cesarean section, emergency and elective. Emergency cesarean section, it is a risk factor per se for thromboprophylaxis. Thromboprophylaxis must be given for 7 days. Till now, our policy changed from 1 to 1. 1 doesn't write thromboprophylaxis, 1 day, 3 days, 4 days. But the guideline recommended 7 days after delivery with molecular weight heparin. This is the emergency cesarean section. Regarding the prophylactic cesarean section, please remember to write thromboprophylaxis. Patient with thrombophilia needs thromboprophylaxis for a period ranging from 6 weeks for a period up to 6 weeks. Thromboprophylaxis. We can give low molecular weight after delivery, or we can give warfarin, but if warfarin is given, must be given 3 or 4 days after normal or cesarean section because the risk of bleeding increases during the first 3 days, and warfarin and low molecular weight are safe during pregnancy. I hope that the message of these topics reach to everyone. The details is available in the line. For example, this is the dose available for thromboprophylaxis mentioned by our colleague. This is the contraindication as mentioned in the previous nice lecture about the contraindication. And this is example of the scoring system. It is available how we can evaluate antenatal, what is high risk, intermediate risk, and low risk before delivery and after the delivery. All of us are aware and we can review, but I need to mention something. The detail of this lecture available in the websites in author stream, and I need you to remember that not only the pharmacological agent thromboprophylaxis, there is also the IV fluids, there is elastic stocking, there is pharmacological. Remember this is time to apply all this element in your life, encourage your patient to mobilize, avoid dehydrations, if appropriate giving pneumatic stocking or pharmacological one. I need in 3 minutes to send 2 messages. The first, I am here obstetrician, we need ICU, orthopedic, and all the member, all must working together as a team. The management of the patient must be in multidisciplinary, not one person do everything. Multidisciplinary team is very important. In this video, I will show how the ant working in multidisciplinary team and can overcome the anteater within 1 minute. Sorry for technical work. Please. How's the ant working in multidisciplinary team? Hoping to be like him. We can overcome any disease of all of us working together the final message in these topics, it is about to remember Allah in our work. Astaghfirullah al-Azim. Thanks very much. Goodbye.
Thank you very much. I appreciate your attitude to be patient.